So, ladies and gentlemen, let me begin by saying that there has been a myopic shift in recent year in the entire global population, so that there is a veritable epidemic of myopia globally. And COVID hasn't helped much, it has increased it all the more. So, just to recapitulate, we all know that children are all born hyperopic. And over the next 10, 15 years, there is a process of emetropization where the axial length of the eye tries to match perfectly with the optics of the cornea and the lens. And in this process, if it is overshot, it leads to myopia. So the key thing to remember is overshoot of emetropization produces a longer axial length and myopia. So we must institute some strategies to delay the onset of myopia or prevent the progression of myopia. And the goal here in these strategies is to prevent an overshoot of greater than 26 millimeters or -6 diopters of myopia. So there are twin strategies that one can adopt. One is delay onset by behavioral modification or retard progression by optical interventions or pharmacological interventions. So in my first talk, I'm going to talk about behavioral modifications that one can do to delay the onset of myopia. There are three things that one can do and advise myopic children. The number one thing is to increase their outdoor time. Numerous studies have irrefutably said that increasing the outdoor time would decrease the onset of myopia. And as you can see in that graph over there, this is a dose response analysis of time spent outdoors versus risk of myopia. And multiple authors have shown over a large period of time, these studies have been done, that increasing outdoor time by more than 2 hours will reduce myopia onset by half. So that is a very important conclusion that has been drawn from so many studies. And it is now recommended that children should play at least 2 hours in the outdoors. Sunlight is very important for retarding the progression of myopia. In Singapore and China now, there is a national government policy that all children in school have to mandatorily play outside in the sun for a minimum of 2 hours. And you can advise your children who have myopia when they come to the clinic that they must necessarily spend 2 hours or more outdoors. They should take up any outdoor activity, outdoor hobbies, or play games like football, volleyball, or cricket. So that way they spend more time outdoors. Now, why is sunlight important for delaying the onset of myopia? This was shown by these beautiful studies in which a person called Tsubota from Japan conducted studies on the myopic chick model and found out that violet rays coming from the solar spectrum upregulated the gene EGR1, which is responsible for axial length growth, and violet rays actually curb the axial length growth. This was carried a step further by Torai and group, and on the right hand side you can see their results. They found out that if you put contact lens transmitting, violet ray transmitting contact lenses on children, or violet ray transmitting spectacle glasses on children, and follow them over a period of a few years, they found out that in those children who wore violet transmitting contact lenses or glasses, they had a lesser progression of myopia than those who were wearing regular contact lenses or glasses. So that is an important study, and they said that up to the age of 20, violet transmitting glasses and contact lenses work very well. Next, the same group took it further ahead and tried to see if violet rays from the sun could help retard the progression of adult myopia. And they implanted several cases with phakic IOLs, one with violet transmission capabilities and the other one which was regular, which did not permit violet rays to enter into the eye. And they found out at the end of a 2-year period that in those patients who were wearing violet transmitting lenses, myopia progression was 2 times lesser than the other variety, and the axial length progression was 4 times lesser than the non-violet permitting phakic lenses. So that conclusively proved that violet light is important, and that is the reason why you have to be adamant in telling your patients and their parents that children should spend time outdoors. The number two thing is it has been irrefutably proved that reducing near work will also retard the progression of myopia. In fact, it's been said that children who use screens more than 3 hours per day are almost 4 times more likely to be myopic. Most children, are playing with smart games on their smartphones, and on an average, it has been said that globally, a child spends about, or a person, young man, spends about 8.45 hours per week on the smartphone playing games. China tops the list at 12.39 hours a week, and India is number 3 at 8.61. Our young people are playing Candy Crush, Clash of Titans, and Teen Panti, and whatnot. So, when the patient comes to the clinic, you should discourage them from using the smartphone as much as possible. In fact, in China, they now have a national policy that they will only allow children to play games only 3 hours in a week. 1 hour in the evening on Friday, 1 hour on Saturday, and 1 hour on Sunday. And I hear that Singapore is going to follow suit very soon. The American Academy of Pediatrics has also said that apart from school-based activities on the screen, the permissible screen time for children outside of school is only 3 hours in a week. The third thing and most important thing to know is that sleeping late also induces myopia. There have been 5 or 6 studies in recent years which have said that if a child sleeps very late in the night, very late means after 9 o'clock, then he has got more myopia progression than those who sleep on time. So one must advise children to sleep before 9 p.m. in the night. So I think there is some truth in the age-old saying, early to bed and early to rise makes Jack healthy, wealthy, and wise. So with these few words, I end my talk. Thank you so much for listening so patiently to me.